Neurological disorders are a major cause of disability and mortality across global populations, affecting the brain, spinal cord, and peripheral nerves that make up the central nervous system, CNS. Neurological disorders directly disrupt the body's communication network, impairing movement, sensation, cognition, and autonomic function.
These disorders arise from a variety of causes, including genetic mutations, neurodegeneration, vascular injury, and also including infections, trauma, and immune dysfunction, or a combination of them.
As populations age and diagnostic tools improve, the prevalence of neurological disorders continues to rise. Among the most common neurological disorders are stroke, Alzheimer's disease, Parkinson's disease, epilepsy, and multiple sclerosis.
Stroke occurs when blood flow to a region of the brain is interrupted, often affecting the cerebral cortex and leading to sudden loss of motor control. Alzheimer's disease primarily affects the hippocampus and cerebral cortex, causing progressive memory loss, cognitive decline,
and personality changes due to widespread neuronal degeneration.
Parkinson's disease is associated with the degeneration of dopamine-producing neurons in the substantia nigra of the midbrain, leading to tremors, rigidity, and impaired movement.
Epilepsy involves abnormal electrical activity in the brain, often originating in the cerebral cortex, resulting in recurrent seizures.
Multiple sclerosis, or MS, is an autoimmune disorder that damages the myelin sheath of neurons in the brain and spinal cord, disrupting signal transmission and causing a wide range of motor, sensory, and cognitive symptoms.
ALS primarily affects motor neurons in the brain and spinal cord, leading to progressive muscle weakness and eventual paralysis.
Peripheral neuropathy involves damage to nerves outside the brain and spinal cord,
often due to diabetes or injury, resulting in numbness, pain, and loss of coordination. Spinal muscular atrophy is a genetic neuromuscular disorder caused by mutations or deletions in the SMN1 gene, leading to deficiency of the survival motor neuron protein and progressive degeneration of motor neurons in the spinal cord. This loss of motor neurons results in muscle weakness and atrophy, with severity influenced by the number of copies of the related SMN2 gene.
Traumatic brain injury can affect multiple regions of the brain depending on the nature of the trauma, leading to cognitive, emotional, and physical impairments.
Spinal cord injuries disrupt communication between the brain and body, often causing paralysis and loss of sensation below the level of injury.
So overall, neurological disorders reflect dysfunction in specific regions and networks within the brain and CNS.
This highlights the importance of understanding neuroanatomy in diagnosis and treatment. Advances in neuroimaging, molecular biology, and neuropharmacology have improved our ability to identify the underlying mechanisms of these disorders and develop targeted therapies. However, many neurological conditions remain chronic and incurable, emphasizing the need for ongoing research. By deepening our understanding of how the brain and nervous system function, medicine continues to move closer to more effective interventions and improved quality of life for affected individuals. And if you enjoyed this video, please consider giving it a like.